months ago when we met, it was about 0.8 hospitalizations per 100,000 population. Okay, so about 1 in 100,000 people. So in Hendricks County, we'd have about 200,000 people, so we'd have about 2 people with RSV in the hospital. That's the way all that works. So it went from 0.8 up to 2.9 per 100,000. So it's gone up relatively, gradually over the past month, but we'll see where that goes.
Does that take in adult and pediatric
Yeah,
together?
that's all of them together. Yeah.
So these 6 cases at Hendricks, were those pediatric or combination?
Those were adults.
Adults.
Those were adults. Yep. Good question. So anyways, like I said, I don't want to, this is respiratory season. So, this isn't anything that the hospital hasn't seen many times before. It's busy over there, but, they're putting in some protocols to limit sick visitors and, those kind of things are being done. But beyond that, they expect this in January, so they're well prepared for this. Yeah. So,
Saw the signed ordinance on the email. Is there anything on the amended? Any other updates on that? Commissioners signed it.
They approved the ordinance language requiring engineers and survey drawings. So we will still very much recommend that they hire an engineer, surveyor, registered, but we can't require it anymore.
But we'll still review the plans.
We will still review the
and
plans.
approve
We
the
will
plans or
still
deny them.
approve them to state code. Absolutely. We will still very much be reviewing everything that comes through. So, yeah.
Yep. Any other unfinished business that's not on the agenda? All right, new business. All right, the award advertising.
Yeah, I can introduce that, but basically, so our Health First Indiana funds, we have community awards that we award as grants to local projects, which has been incredibly exciting, some of the things that we've been able to fund around the community. Currently, a lot of that advertising is going through our health partnership, and people they know, and, just kind of keeping it the advertising somewhat of a smaller subset. I think we're getting to the point now where a lot of those grants, those people that wanted to present in front of us have, and we're trying to figure out how broad to cast the net, basically. We can publicize it everywhere. That will definitely we will have a whole host of people, or if we start kind of reaching out to partners that maybe we haven't heard from, different charitable organizations, or kind of that maybe didn't hear about it, if we wanted to cast the net a little closer than just kind of the blast across Facebook. Just trying to figure out if you guys had any opinions along those lines. I don't know, am I missing part of the story there, Krista?
No, that really covers it. I think our thought was, and Michael put it well today when we were speaking, that we wanted to start out with promoting it rather than advertising. So like you said, reaching out to partners and that. I think we do have some ideas of some people we can still reach out to, like you said, that haven't come forth yet, but we know probably could have good projects. We're thinking that maybe we should kind of hang out there for the next month is when we're accepting these applications. We will have another round this year because we will have more funds to award, I'm assuming, based on the applications we have so far. What we would like to do when we advertise and do that bigger net is be able to do that along with some success stories. And our other awards are really just getting started. What we'd really like to do is let them kind of get underway and be able to say, this is all the great work these awards are doing, and this money is available. Right now, it's kind of, we've awarded stuff, but we're waiting for the projects really to get going. So we're kind of in that promoting and not advertising, but yeah, we're looking for some guidance on, do we think we need to kick up our messaging more, or kind of hanging where we are right now, and just individually reaching out, promoting it the way we are, and then after this round, kind of kick it up another notch.
Who's reviewing the applications for the awards? Who's making the decision? It's a group of people, correct?
Yes, so
Reviewing these,
the health department staff look over it initially and provide recommendations. But then we have an advisory team that reviews all those and then provides a recommendation of what's awarded and what we may need more information and look at again later, or what may not be a good fit for our community.
Yeah, I think when you're considering like to cast the net wider, well, then if you're gonna get a lot more applications, that means that's more work for that group of people to sort through, and then how timely can you be responsive and not just be something that just sits there, you know, if people have expectations of trying to do it, so. I don't know if that gives an answer, but I think that's something to consider
And it's still open now. I mean, we have it on our website. We just haven't done like advertising, like go look here. We're open with it. It's in our minutes. It's on our website. It's available to anyone. It's not like it's only available to our partners. We just haven't like social media or ad type, go look here. Because we do want to work with those partners that we know are doing this work in the community first. And I think we have a little bit more room where we can still grow there, but we're getting close to needing to cast it further.
I mean, I think if you have the capacity and the funding is there, why not cast it? And if it means that people are gonna help people in the community, why limit it, I guess? If you have the capacity to keep up with it. I don't know, what do you guys think?
Do we have the staff, once we grant the grants, to keep those going or to facilitate those?
We do. We have the staff here. I think part of the wanting to wait until the next round to advertise and cast up more is so that we have that great messaging. So if we can kind of build what that story is, instead of just see the website, it's look at this great work that's been being done with these dollars. It's somewhat of an advertisement for Health First Indiana and the whole 9 yards. So I think this next round is due by February 16th, all the applications. The advisory team will review them in March. And then after that, we can work on kicking it up another notch if you're comfortable with that.
Yeah, I think that sounds reasonable. I don't know.
Krista, would you be able to bring some suggestions to the March meeting about, here are some avenues that we think we haven't tapped yet or gotten the response from that we can consider at that point?
Now, our staff is going to work on some of those here in the next week, so hopefully by the meeting, we have heard from them.
Okay.
So at the March meeting, it may be more, this is what we've done up to this point. What ideas does the advisory team have? Should we just blast out social media advertising? Are there avenues that we're not thinking of that the advisory can think of? So we'll try to exhaust what we know of before the March meeting, but then we'll probably look to the advisory team in March on now how do we get the word further.
No, I think you're thinking appropriately, I don't know. I mean, having success stories is nice.
We don't want to be missing things, or if you know of partners now that we can reach out to and, directly, I mean, those are conversations that we can have. But we want the money to go to good use. But also we're kind of, taking steps as we implement, so it's.
A bad idea.
I'm gonna step out and get a drink, you guys keep going. It tickled my throat.
Oh, no.
Not safe, not that respiratory illness.
Watch out, yeah. Yeah, okay, yeah, exactly. Poor guy. Do you guys, you've had just, give him a second to get him a drink, but any thoughts on like avenues that you've had success advertising beyond like Facebook and Twitter? I mean, just in your different walks and arenas, I don't know if you've had any specific, billboards work better than, I don't know, commercials to, I don't know.
Right now, it's still, the old one is the word of mouth. I mean, that's still the
Yeah.
best one. I think social media, we're all so saturated. After a while, you
Yeah.
just, the doom scroll,
Yeah.
you're like, I'm tired
Yeah.
of scrolling, I gotta get off. You know, so it's so hard.
Radio, okay, yeah, that's a good point. I do listen to the radio a lot at work.
It's so different now with just the way media is presented,
It is.
news, I mean, newspaper, for example, you know, I mean, does anybody even get a newspaper?
Yeah, I don't know. Yeah, it's more, yeah.
Handful, I guess.
It's more of a general question for advertising in general. I don't think it really pertains to this topic per se, but, you
Right,
know,
but that's a good-
as we try to figure out ways to advertise, you know, vaccine clinics or whatever else we need to advertise.
Yeah, as I work with local community partners throughout the state, everybody's in the same boat, just trying to, how do you get people to come? So a lot of places, you know, they're giving gift cards, you know, you guys remember when COVID was big, people were giving out
Yeah,
stuff,
small.
and people would still not show up. So it's just, you know, it's just, you do what you can.
Busy
you know,
times,
but-
yeah.
I don't know if, they generally want money for the story, but, if you talk to the folks at the Icon, talk to them, get them to run something just about the good things that the health department is doing, and then, oh, and by the way,
Yeah, by the way, there's something else going on. Yeah, no, the Icon's a good resource. It's really good.
I think people always at least get that cursory glance when it shows up in the mailbox.
Yeah, and it's local, so.
Yeah, that's good. Thank you. All right. I think we're,
On to the next one. All right, the potential non-syringe harm reduction program.
well, I was told I'm gonna very briefly introduce this, and I'm gonna hand over the mic, but, basically, there is a program with the state looking at, harm reduction for, it's mostly for like IV drug use, so different ways to make that safer for our friends that are still struggling with the addiction, so. There was a conference call that sadly I was seeing patients and unable to attend, but Nicole and Krista and Susan back there were able to listen to, and it just happened yesterday. So it just kind of an introduction, yeah, hot topic, yeah. So we still have many questions, but saw this health board meeting coming up, and I thought we'd at least introduce a few things and get some initial opinions from you guys about kind of the program in general. So I will pass the mic to whoever's talking back there.
Hi,
Yes.
Susan. One of the public health nurses here, and we're wanting to start, like Dr. Sharper said, start the STI clinic again, and along with that, the non-syringe harm reduction program. So no syringes that we would offer, but the non-harm reduction. We passed out paperwork in the beginning, the case study in the front, and then the list of items that we would offer with the help of the state, minus that top one, the syringe. But in the front, this was off the CDC website. It's a case study that was done with the Illinois Department of Public Health, done, it looks like April of '24. And it just kind of reiterates the benefits of the non-syringe harm reduction program. I think they did syringe with theirs, but that it can reduce the occurrence of HIV and hepatitis, improve public safety through safe needle provisions and disposal, and it's not associated with an increase in crime. So that has been studied. And then also it gives critical linkages to treatment for substance use disorders. So it actually will help reduce the use of these substances in the community. And that's just all there for you guys to take a look at, and some links as well if you're interested. And with the supplies there, it separates it kind of nicely. Supply example, the function, so just the bleach is disinfectant, and then for people that can't get a new syringe each time, they can use the bleach to help sterilize that so they're not exposed to those diseases, so.
So the list of supplies are options that we can have. The state will put together a kit for us that we can get, or we can get different supplies, kind of put together our own kit. The attestation from the state has a list of things that we should provide, which is kind of more conversations that if we go forward with this, that we'll have to have with the state on, is it a should or are they requiring certain things? But in our short conversation, it sounded like there was a kit that they could provide, or we could pick some items as well. And our first vision is just to, in our conversation with our patients in the SDI clinic, if it's something that will benefit them, just having another item for them to help in their journeys.
So that's where you see it actually come,
That's
being
where we would
administered or
start.
given, or
Yes.
these things given out.
Possibly
through
with
that.
like our naloxone, they're having those conversations, but more in-person conversations is where we plan on starting it.
Yeah.
We'll offer it to everyone that we see in SDI, so there's no discrimination, but they can always opt out. And even if they have a family member they need it for, I mean, there won't be questions, just this is a option for you if you need it. But starting with the in-person, we're kind of screening the people before we're handing it all out.
I see they're doing injectable naloxone on this picture, but we're doing nasal, right?
Nasal.
Okay.
Their big goal is just reducing the HIV, hepatitis C numbers and transmissions.
Nicole, a few years ago, time gets away from me now, I can't remember. There was a county down south,
County.
yeah, and that had horrible issues, and they did needle exchange.
They do the syringe.
And so, I guess, nobody wants to end up, that they had so many cofactors going on down there, it wasn't even funny. But do we have any kind of information on what the prevalence in the community, our community is for this?
Yeah, so the numbers that I could find, they posted an annual report for 2023, so it posted in June of '24. So those are the numbers I could find right now. HIV, we were at like 17 new cases, but around 300 people living with HIV in our county. Hepatitis C was around 30 or 40. If you look at our numbers, sometimes they're higher because of the Department of Corrections in our county. So when you take those out, our hepatitis C numbers aren't as high for our county alone, but those were 23, so they're probably up now. I'll look at annual numbers soon, so I should have more better numbers as I collect it from the state soon.
Any questions on this? I mean, obviously, I don't think we're giving a blessing or anything about it.
Yeah,
but
yeah,
I think it's more
nothing
questions and
official,
things
yeah,
like
yeah.
that, but I think
Yeah.
it is a somewhat charged issue a little bit on some of this stuff, but I think it's all very appropriate things to be doing. And I don't see it as an issue to move forward and doing it, but I think the whole needle exchange stuff and then what level of stuff are you guys gonna be doing in that STI clinic? How much do you wanna do? And that becomes a little bit of a decision for you guys to make, but, yeah, I know that the family doc who was down in that county, the one who kind of ran that, Dr. Cook, and when all that was, the HIV numbers went to a national hotbed for population down but there, yeah, a lot of factors of poverty and prostitution and just needles, people coming in, and it just was, yeah, so it definitely is still a real deal to keep dealing with, and real problem out there, so.
Yeah, obviously, we will, before we do anything like this, we would get make sure we're all on the same page with, commissioners, council, this is not something we're starting on Monday, just wanted to kind of get the temperature, I guess, of the health board, tonight while we had you here, just in case, this does start rolling up further along in the next couple months, that, it sounds like that most opinions are pretty supportive, so.
So in this program, would there also be connections that you can provide for recovery? If someone comes in and says, I'm done with this, I need recovery, I don't know how to go about doing that, that would be something that you would engage them with? Okay.
Another question I have, I know sometimes people go outside of their county because they don't want people knowing they're,
Oh, yeah.
and they still can come here and perhaps get this kit. This is for anybody.
Yes, yeah, they don't have to live in our county.
Gotcha.
Any other comments or questions?
Appreciate your input.
It's a hard topic. I think, we're in the business of preventing disease and preventing problems and helping people out and helping the communities. And this is definitely a need in the community, so sad but true, yeah. All right, the attorney hourly rate decision. You guys saw that message come out, hopefully a rate increase for Eric. Anybody have any questions? Is raising current rate from 250 to 300, correct?
Which is what I thought with Graham Young's who, Greg, but Graham built in session, and that's their hourly rate as well. So we've generally tried to kind of stay in the same. It's been 5 years since I raised it, so it's been a little while.
I'll vote to raise it if you raise my personal rate alone.
In 2024, approximately how many hours were we billed from Eric?
Yeah, I can, let's see.
He's checking.
Well, I didn't hear that.
He's checking. He's got it right now. He's
Okay.
looking up.
Just, I was just curious, what the impact is.
So there's a flat fee for the attendance at these meetings. So everything it was a total of 19.2 hours, $7,286.07. That's with like certified mailing and stuff. But the flat fee part was $2,700, so about $4,500 of it would be under, like outside of the meetings.
19 hours is what he said, about total.
So this isn't big money. No, not at all.
He's not retiring off us. Is that what we're saying? He's not gonna retire based on these meetings.
He's like, well, I'll make it 500.
I would like to make a motion to improve or increase Mr. Oliver's hourly fee to 300 from 250 going forward.
This is Bruce, I'll second that motion.
Okay. Let's go around and give your votes.
No. Brian Cobb, I agree. Aye.
Chris Tridison, I agree.
Larry Gasky, yes.
Drew Kogel, yes.
David Harden, yes.
Deborah Campbell, yes.
Bruce Dillon, yes.
Okay.
I'll send the thing, and then we can get the commissioner's signatures, what we've done in the past.
Any other new business not on the agenda? All right, seeing none. Lisa, environmental.
So continuing the year-long saga that I've been reporting on for the new food code, 7-26, it has finally passed by the Indiana Department of Health Executive Board. So they're talking a possible adoption date in April of this year, so that's kind of exciting. Just a few other things. I'm gonna start working with a standardization inspector from the Indiana State Department of Health next month to become a standardized inspector. I used to be standardized. I was last standardized in 2019. It's basically a program, so the FDA standardizes State Department of Health inspectors, and then they in turn standardize us to help make the entire state more uniform when we're out doing inspections. So we had, 3 or 4 of us on staff that were standardized at the time. Unfortunately, the state kind of stopped the program due to lack of staffing. So it's been a while since anyone has been standardized again. So they finally are starting the program back. So I'm going to be starting that. We have to do annual maintenance inspections with the IDOH inspector. So the goal would be for me to become standardized and then train my staff. So that's exciting. Environmental staff completed over 2,300 food inspections and just over 1,300 pool inspections in 2024. Kristen and I will be working on collecting other environmental health annual report numbers as well. I think that's all I have.
Any habitual non-compliance that we need to worry about?
So yeah, I wasn't at the last meeting, but those 2 restaurants did comply and are back in compliance now. Yes.
Kristen,
Hi. Septic season, it's winter, so there's not much going on. So right now we're in full education mode and going to trainings. Our Paul and Aaron are working on sending out letters to homeowners. So we do like a 5-year kind of rolling info that we send to homeowners. I brought something and pass it out to you. Essentially, if you're permitted 5, 10, 15, 20 years ago, we send you a bunch of information on how to keep and maintain your septic system. So in case your house has been sold and somebody new's living there and they have no idea what to do, now they have this information. So it's kind of fun, and we request if they want to, they can send us pump receipts and inspection receipts, and we can keep it with their file. So kind of just info for homeowners. We are also working through our hiring process for our lead and healthy homes position. So we're moving forward with that. Good, high hopes. We're excited. Last meeting, Eric briefly mentioned a enforcement that we have taken on an abandoned property with an open well. We had hired a contractor and had that filled, so 3rd time's a charm. Hope it stays full. Did a little bit different method this time, so hopefully it stays full. We've got pool permits for 2025. Indoor pool permits have been all taken care of for 2025. Body mods are all taken care of except for 2 of them, so 37 out of 39 is pretty good for us. We'll send out letters this week for the other 2. With the body modification, last year, temporary events, there were 4 of them outside of that tattoo convention. So people are doing like these little pop-up tattoo and little piercing things that they're getting permitted for. There were 4 of them last year, which is kind of exciting. I'm glad they're getting permitted. It's an extra inspection for us, which is fine, and we're happy to see that they're doing things hygienically and in a clean and safe space. So, and we're already getting phone calls for a few coming up this year. So, I don't know, kind of exciting new little trend we've got going on, and that's it. That's all I got.
I have Leanna's.
I was gonna say, she's not.
Yep, Leanna apologizes, she's not able to be here tonight, but she did provide an update. So at this time, they are fully staffed. Their new hire, Jerry Ray, joined them in November and started training for the full-time family support specialist role. She has a background in education and worked with families and diverse populations via her time in the public school system. She's been shadowing and completing some of her training these past few weeks, and so far seems to be a great fit for the position. They had a grant, My Healthy Baby grant, that came to an end December 31st. This grant really allowed healthy families to invest in some curriculum that otherwise they wouldn't be able to afford. In November, staff completed Partners for a Healthy Baby training, and in January they're all going, they're starting their training in Growing Greater Kids curriculum. Both curriculums are evidence-based and written with Healthy Families America home visiting model in mind. Staff have had nothing but wonderful things to say about the usefulness of these curriculums and how much they've enhanced their ability to serve families. Being able to invest in both of these has been a real asset to the program. And then their annual site review is scheduled for February 25th.
How are they settling into the new
Well, I was gonna put that in my update.
Oh. Go ahead.
Hers all positive.
Okay.
So those are valuable trainings, but the grant went away, like, is this something that can be funded?
It was a
another
short
way?
term, it wasn't one that was expected to last, it was kind of a kickoff, trying to bridge some gaps that we had. It was really, I think it started in '23, so it was scheduled for those years. So it's not something they expected to keep going.
Do they need it to keep going, or are they good now with the?
Health First Indiana is really helping us out. It's not panicking for healthy families. Before, they were really scrounging for every dime they could get, not getting the pay increases they need, that type of thing. We have high hopes with Health First Indiana. If it continues, that we kind of have that safety net, and they can buy some of those things that they've been going out finding little grants here and there.
right, okay.
It's easier administratively if we have it all under one, so. More plugs for Health First Indiana. We want that
Right.
public health funding, because that really, that helps. We don't have to go find all those grants, but it was a great opportunity, but it wasn't expected to. They were really excited about the curriculum. What they were using was older than at least one of the staff members. They were excited to have some updated materials to work with. Leanna mentioned that she didn't realize how much time they were taking in filling in the gaps of things that have changed over time. So now they have a more streamlined approach that they can take with families.
Nicole?
So we started our flu and COVID clinics back in October. So I ran the numbers of the vaccines we've administered since then. And we've given 443 COVID vaccines, 545 flu vaccines, 14 adult RSV, and 12 infant RSV. And we still have those vaccines available if anybody needs them. We updated our interpreting services to add a video option. So we have a tablet in the clinic so we can get a person on the screen to help with patients. But two of our newest nurses can speak multiple languages, so they've actually been super helpful, and the patients like that a lot better, having a person there to talk to. So they've been great jumping in, helping with interpreting. We talked about the STI clinic. So one of Susan's goals is to start that clinic in February. She's working on tying up all the loose ends to get that going, ordering all the supplies. We're gonna start it by appointment only, since Susan's working part-time, and kind of figure out what her schedule will be, but we will allow walk-ins as well. So if someone walks in and we're available, we'll test them as well. And then we've been working with the outreach team. Danielle's been helping get information together for daycares and preschools to send out immunization information to definitely help with that kindergarten time, reaching the daycares and preschools. And then our immunization nurses sent out letters to providers focusing on our childhood rates to try to get those up. And then lastly, some of our staff will be going to the public health orientation at the end of January that the State Department of Health puts on for new public health nurses.
Nicole, do you, or Dr. Stoppers, do either of you, off the top of your head, know for kind of your big, MMR, those kinds of things, where are our childhood immunization rates as a county holding at right now?
Yeah, it might be on there. Our childhood series for our county, I think is at like 59%.
Yeah, it's
So I
not-
think
it's
our
not-
rankings on that paper.
It's not great.
It's not the best.
It's not the best, yeah, it's gonna.
It's very good.
Yeah, the theory right now, we're trying to figure that out. So we're trying to figure out the story behind the number, basically. We are wondering, when I had a meeting last week, we meet once a month with some of the school nurses and the school leadership over at HRH. And their thoughts was that it may be due to immigration, I guess a higher level of immigrants from some of the warehouses, or, but I don't know. I mean, just trying to get kids caught up, getting their shot records over. We're trying to figure out the story behind the number right now, so, and then, but yeah, I mean, like I said, I've got some ideas on how to get more information, maybe some surveys out to some providers, or, see what people are seeing out there.
Yeah, the reason I asked the question, I was reading an article the other day talking about just the trends in vaccination rates, and I mean for the scary things like polio and stuff like that, and some states we're seeing almost double-digit drop over the last 5 years. Indiana didn't look as bad as some of the other states on there, and then some of the ones, and obviously there's been changes at the state level in some other states that, like in Louisiana, they can't even track the data. You know, they've had the ability to track the data taken away from them by statute. It's like, that's scary.
Yeah, I mean, in my office, I would say the ones that are not completing their vaccination series are the ones that aren't required, they aren't going to school. They're homeschooling. Those are the ones who are not planning on, they're not gonna do certain vaccines, and they know that it's not gonna be required for them because they're not gonna go to school anyway. That's the population that we see.
Yeah, so, you know, that may be back to our advertising campaign, you know, I mean, that'll be the only way to really reach those folks, but,
And they're
yeah.
proactive on their health, I mean, they're coming in, but they just don't, they choose not to do certain
They can
vaccines.
choose which ones they want.
Yeah, I mean, that just, once again, seems like I'm still pretty, you know, I mean, we're right at about 60% for childhood vaccination series, so that's still, there still seems to be more to that story. I don't know how many.
I would think there's
homeschool-
access to, I would think
Access
that
issues,
they-
maybe, yeah.
I mean, there's not a ton of Medicaid providers in Hendricks
Yeah.
County.
That's a good point.
They're not. I mean,
So
it's
maybe
just-
that's, yeah. Yeah, that's gonna be one of our.
And that'd be an at-risk population more so typically, so you really, yeah.
Yeah,
Hit
I
that.
mean, you can imagine what, also if we can, you know, I don't wanna make this all political, but, you know, hey, Health First Indiana funds were, you know, we've had them for 3-4 years, and now our vaccination rate went from 60 to 70%, you know, I mean, those are the stories that would be outstanding to tell. But yeah, like I said, we gotta figure out what the story, what the factors are right now, and that's kinda where we are right now.
I'd love to have the resources to be able to identify which children are in the community, whether they're here on Medicaid rolls or stuff like that are not, you're seeing not getting the vaccinations. Let's reach out to them with healthy families, they identify the vaccines, they get linked up to you, and maybe someone goes out to them and gives the vaccine. Like, you know, it's like a partnership to, if there's, you gotta have resources and people, but if we've got access
Some phones, yeah.
to some funds now, that, is it something that is a possibility in our community to?
Yeah, try to figure that out, get the vaccines to them.
Does the health department have a certain number of immunization clinics that you plan to do each year? Do you know a number, or is it just as many as you can do?
So we have our clinic at the health department throughout the week. And then we coordinate with the IIC to at least have 2 off-site clinics throughout the year. I mean, obviously one of our goals is to be able to do more off-site, but resources, staff, all the hoops to jump through with state vaccine. But I mean, it's one of our goals and visions is to have more off-site, especially with the schools.
I think we also find that this is the time of year that nobody's thinking about it. It would be great if all of the people who have kids in school could bring them in, kind of have the forethought to get them in earlier, but most of them wait until the summer months and then they go into panic mode. So we're trying to find a solution for that. How can we get them in, you know, in a more timely manner?
I would think there might be a way of making, and maybe you've already done this, but contact with Family Promise of Hendricks County, because they are getting more immigrants into their system, or making contact with them before they become homeless, and getting them into places where they can live, that maybe they are not. I know they've got the immigration center now down in Plainfield.
We have reached out to them when they started, but that's a good point. We
Yeah.
can touch base with
I
them.
would think that would be
I was gonna say, I think that Danielle, she's hit the ground running, and I know she's, I
good.
don't know, she might be able to tell you a little bit
Excellent.
about it. so.
I met with Family Promise Immigration Services to address sorry, I feel like I'm looking over inside. No, just to, when I initially started a survey of the schools and the issues facing school health, the immigrant population was by, just very, universally recognized as, something we love, also a barrier. It's definitely a barrier with language and cultural expectations. So I did meet with Family Promise Immigration Services to kind of talk to them a little bit about some strategies that we can come up with to support the families.
Good, excellent.
Yeah, so,
Good job.
yeah, thank you.
Yeah, good stuff. All right, Ian.
So this time of year for outreach is kind of, we're more in the planning stages. Things pick up for us in the spring and summer months. So, you all should have a little piece of paper talking about our next Tobacco Coalition meeting, which is great. Finally, kind of have that up and running. So, open to anyone. So I'll let you know about that one. We are currently trying to put together our SOBR team, which is Suicide and Overdose Fatality Review. Invitations to that initial meeting will go out soon. If you have any recommendations of someone you think might be, good for that coalition, please, or, let us know for that review team. Like I said, we're in the planning stages of things that we want to tackle this year. Preparedness, as always, Jeff, he's always prepared.
It's a good sign.
Yeah, he's got his full schedule for the year set out for his Stop the Bleed classes and CPR, so that's a good thing.
Yes, yes, good. That's what we want.
We have some different ideas of things we want to do. I don't have a lot of details yet, but we did host a diaper drive with the county employees and got a lot. So our hope is to hopefully start a diaper pantry soon. There will be some rules and some things that apply, but we don't want it to be too restrictive. But until we get moved and kind of, iron out the details, that's on hold just for a little while. But I'm pretty excited about that because there's a need, so we'll let you know.
All right.
To answer the question on how they're settling in, they're not settled in yet. So we've had some IT challenges getting them set up over there. So they have some things moved in, but they're not operating out of that space yet. So we're not moved
Well,
completely
I
as of yet.
running Ann back in December, and she was talking about how they were having to use their phones as hotspots for certain things. I didn't know if that had gotten resolved yet or not.
Not completely. I mean, they're making progress, but working through the IT issues has taken a lot longer than we anticipated, for sure. They're still working on that. I know John Greenlee was over there today working on it. And they keep making progress. So. But they're not moved quite yet, so hopefully a better news on that front in March. Surely by March, right? Yes.
Yeah.
Because I know we're to the point now, we're talking about onboarding people in the next month or two, and we have no place to put them. We're operating on faith that we will have a desk available, and right now we're just going through the onboarding process, and I don't know where they're going to sit. We're trying to get a result as quickly as possible. So speaking of which, I want to, Kristen had mentioned the environmental health specialist. We're also going to have an AmeriCorps member through the Indiana Department of Health again this year. So they're going to be helping mainly our outreach team. They want to shadow and just learn in general about public health, what the health department does. Primarily, they'll probably be working with Jeff in the preparedness projects he's got going on with the exercise and some other things. But then also, in general, help out the outreach team. So they'll be here part-time, not a county employee. It's through the Indiana Department of Health, but they're placed here with our health department. So we are looking forward to having their help. The flyer that we were looking at for the vaccine rates, that is a flyer that the Indiana Department of Health put together to give to legislators during this session. So they made a one-pager for each local health department, and that is the information that they put together for Hendricks County. So just wanted to share what legislators were being handed for the work that we're doing. And of course, it's just highlights. I mean, if you get questions, there's a lot more information that we can provide to folks, but that's just highlights that they're getting. And right now, we're looking at budgets, not for budget time, but for carryover requests. So Health First Indiana funds that weren't spent in the first year, plan for what to do with those dollars. And generally, the plan is to look at where we may have missed something in our 25 budget, see if we need to fix anything there, and then throw the rest of the money at our community awards. So that's the general game plan for that. So we'll go through that process. I've also spoken with the auditor's office, and we want to try to clean up some old grant money that we have. So we have some funds from previous grants that we had just a little bit of money left, like we spent down to $30 or whatever, where it was just, but we never cleaned up that last bit. So we're gonna go back and look at the contracts, make sure that we know what those funds can be spent for, and try to clean up some of that old funding. So they're not tracking as many different funds that aren't active. So that's another plan too. So that was all I have.
Next up.
Not really. I think I've talked about everything on my personal agenda. Just thank you all for your opinions tonight. I think as we grow our health department and have more and more programs, we're going to need more and more guidance, and really appreciate your opinions tonight. And we'll keep bouncing ideas off you in the near future as well. So, but really important. Thank you for helping to guide us on some of these decisions we're making. Really appreciate that. And I also just wanted a quick tip of the cap to Eric. When you're talking about money, what you do is really invaluable for. I truly thank you for all that you do for us. There's a lot he does behind the scenes. All the emails and the phone calls, and so thank you. That's all I have.
Yeah, one question.
Yeah, what's up?
Now with the new administration, any things that you're hearing that may change overall in the state with the new governor? Anything that mindsets?
Nothing that I've thought about yet. So I guess time will tell. But yeah, I don't.
I saw the short list of the legislative goals, and there's really not a whole lot of public health on those goals. I didn't see anything that was.
There were a few things, of course, there's
Nothing
a septic
super.
thing on there, but I think it was mainly cleaning up some things with how the technical review panel operates. There weren't a lot of direct things. I mean, of course, we're interested to see how the funding keeps the budget goes, but direct bills are worth a lot.
There's a date to remember on the agenda there. March 12th is the Public Health Day at the State House.
Now, that'll be after,
Our meeting.
well, I was gonna say, that'll be after any bills will have switched houses between the House and the Senate. So it'll be on the back end of things, but is there going to be a need for anybody from this board to be there to lobby for anything specifically, or just be there to show support for keeping Health First funded at an appropriate level?
Good point.
I'm not sure. I've never been there to one of those days.
It's really more of a rally. I mean, I think if you want individual conversations, those are things that you would schedule separately. It is, I mean, there's a lot going on. They have some great presentations, but it's more of a show support for public health in general than being able to have those individual conversations.
I guess, Krista, I'm trying to remember who carried, in the last budget cycle, who carried the bill for, Health First in the state legislature. But I guess, is there a need for us to meet with, the Greg Stewart-Walls and Jeff Thompson especially, since he's the guy with the purse strings, down at the State House to make the case for anything, keeping in mind we don't have those nice success stories just quite yet that you were talking about.
Yeah, I mean, the state has done a great job, the State Department of Health, of having those conversations and keeping legislators informed with what is being done. Because there's a lot of work that's being established, but we don't have those end results yet. But there's also a lot of projects that are already out there and in use, and they've done a great job kind of lobbying on our behalf and showing all of the work that's being done. Obviously, as much support as we can have, if there's any questions or that, but I haven't heard of any specific things like there's concerns about X, Y, or Z. I mean, budgets are always a conversation, but I haven't heard of anything that's alarming or we need a special help discussion about this particular topic. I've heard.
We actually sent an email, what was
Did
that?
reach out to all.
About a month ago, something like that, yeah. Yeah, to, Jeff Thompson and,
All of our
Brett Clark, yeah, but several of our representatives too. And it elaborated on some of these, probably more so than the one pager, some of the projects that we're, involved in. So, kind of our pre-success stories, things that we were at least funding and helping out, especially those community awards, really help us out in that regard. So, got some cool things that are being developed because of these funds. So.
Larry, anything from the county council?
Don't have much relevance to say. For those of you who are interested in IU basketball, I checked a little while ago, and apparently they're playing Illinois, and they're attempting to prove that the game against Iowa was not a fluke.
That's not good.
I was just thinking, talking about the compensation for the attorney, just brought to mind years ago, before any of you were on the board, Tom O'Brien was the attorney for the board, and for a number of years, his compensation was $1,000 a year.
Before the times have changed.
How many billable hours was that?
Eric has done a lot more than
I was on that board, one of those old guys, I don't think he was the attorney, but there wasn't a whole lot going on at those meetings. So
No.
I used to go. Yeah. Definitely the attorney was not getting involved in anything. So, Eric, speaking of that, anything for you, you know about?
No, I mean, we worked through a few contracts and like, not necessarily MOUs, but just that type of stuff through, that are some contracts or agreements mainly through the state. So we looked through those, didn't really have many issues, but there's no litigation pending right now. The hole's been filled in, as was said, so.
There are different ways to fill in the hole, evidently. Okay, all right. Anything else for the of the board?
I should make a motion to adjourn.
All right. All right, we are adjourned. Thank you, everybody.
So long, all.
Thank you, Bruce.
Thank you.
Stay warm, Bruce.
The 11th. About 16 or 17 middle students. It was supposed to be the week before, but they had to move it for a variety of reasons.
Everybody says, the reason I'm saying that.
I mean, I'm sure we'll have a
We should. Just when that email, well, she'll know, but yeah, let's have to make sure.
Check in.
There tends to be